In this video, we're going to discuss the drug phenobarbital. One of the trade names for phenobarbital is Soloftin. This is the oldest anti-epileptic drug in common use. Phenobarbital is a barbiturate and was the first anti-epileptic drug used in 1912. It is used for generalized tonic-clonic seizures, which are seizures that manifest themselves by having a stiff phase and then a twitching phase, and perhaps the patient has confusion thereafter. It is also used for treatment of complex or simple partial seizures in adults and children. These seizures are thought to arise from a certain area in the brain. Simple usually implies no loss of consciousness and no confusion. Complex can imply an aura, loss of consciousness, and a post-seizure phase that is marked by confusion. Phenobarbital can also treat tonic seizures. These are seizures where the patient becomes stiff for a short duration. Phenobarbital can also treat atonic seizures, which are seizures where the patient has low tone and is sloppy for a short duration. The medication is usually used as a second-line agent now. Phenobarbital can be taken with or without food. The way the medicine is taken depends, of course, on what form the doctor has prescribed. Phenobarbital is usually taken just once a day. Most people find that sleepiness is less of a problem during the day if they take phenobarbital 30 to 60 minutes before bedtime. If needed, tablets can be crushed and put in foods for children. A liquid or elixir is now available for those who cannot swallow pills. This liquid can be given with water, milk, or juice. Be sure to use the same standard size medicine spoon or dropper each time to get an accurate dose. You should store phenobarbital at room temperature, away from direct heat or direct light and dampness. If you have the liquid form, you should prevent it from freezing. Be particularly careful to keep phenobarbital out of reach of children, since overdose is especially dangerous in children. Don't use more than the doctor prescribes. If 1 or 2 extra tablets or an extra spoonful of liquid are taken, you should call your physician for advice immediately. For larger doses, call your local poison control center or emergency room right away unless you have other specific directions from your doctor. Don't stop using phenobarbital or change the amount taken without talking to your physician first. Stopping any seizure medication all at once can affect other medicines in the body. It may even cause more seizures. You should ask your doctor what to do if you forget a dose of phenobarbital. In general, a forgotten dose should be taken right away, unless it is almost time for the next dose. In that case, just use 1 dose, not a double dose, and call the physician's office for more advice. Phenobarbital is listed in pregnancy category D. A large majority of women who take phenobarbital do have healthy, normal babies, however. The risk of defects is higher for women who take more than 1 seizure medication. Women with a family history of birth defects also have a higher risk. Phenobarbital is excreted into the breast milk because it is long-acting. Your baby will need to be watched for drowsiness. The average amount of phenobarbital taken in by nursing infants is between 2 milligrams and 4 milligrams per day. All women who are capable of becoming pregnant should have at least 0.4 milligrams of the vitamin called folic acid every day because it helps to prevent one type of birth defect known as spina bifida, in which the spinal cord is not completely enclosed. Women at high risk, such as those with a history of this kind of defect in previous pregnancies, should take 4,000 micrograms or 4 milligrams daily beginning before they become pregnant. In general, the risk of defects is higher for women who take more than 1 type of seizure medicine and for women with a family history of birth defects. You should call your primary care provider and neurologist immediately if the following side effects occur: rash, joint pain, nausea and vomiting, sleepiness, and behavioral changes. The most common side effects when the medication is first started are sleepiness or lethargy, dizziness, balance problems, nausea, vomiting. Hyperactivity can be found in children, easy bruising, fever, and infection. The most common side effects when the medication is increased are lethargy, problems with sleepiness or sedation, trouble with speech, trouble with coordination, nystagmus, which is otherwise abnormal eye movements. These effects should get better with time as the body adjusts to the medication. However, if they are severe, persist, or worsen, please inform your neurologist or your primary care provider. most common side effects when the medication are chronically used are cognitive dulling, osteoporosis, contractures, or frozen shoulder and joint pain. Other side effects that may occur are a condition called agranulocytosis, which is a lack of white cells in the body. It can also cause shoulder-hand syndrome, where the shoulder and hand become stiff and discolored without an apparent cause. Your neurologist can monitor phenobarbital by ordering a level. The normal levels of phenobarbital should be between 20 micrograms to 40 micrograms per milliliter, but you should remember that your physician is treating you and not the numbers. The drug interactions that phenobarbital have are carbamazepine, otherwise known as Tegretol, valproic acid, otherwise known as Depakote, Lamictal, Topamax, Gabitril, Depakote, and oxcarbamazepine. Gut absorption of phenobarbital is reduced by calcium-based antacids. Haldol, risperidol, and quetiapine are all decreased in effectiveness by phenobarbital. Benzos, such as benzodiazepine, interact with phenobarbital also. Theophylline, otherwise known as Theodor, warfarin, otherwise known as Coumadin, cyclosporin, statins, and atorvastatin also interact with phenobarbital. It is important to remember that all anti-epileptic drugs are thought to increase the risk of suicidal ideation. Please inform your physician of any signs or symptoms of depression, such as feeling guilty, insomnia, decreased overall energy, agitated state.